Welcome to all of you. Good morning, good afternoon, good evening everywhere, everyone, everywhere you are from all over the world. Welcome to all. Also welcome to those who will join us at the recording. Today, we will present on FIP event development goal number 20. It's a goal on digital health, which is a very tiny and promising topic. And this is the fourth webinar of a series of digital events in the FIP goals. My name is Jacqueline Surug. I am a hospital pharmacist. I'm working in a 1,300 beds hospital. I am a vice president of FIP, and I am the chair of the FIP Technology Forum. Just before beginning, some housekeeping rules. First of all, the webinar is being recorded and live streamed via Facebook. The recording will be available after the session on our website, wawawa.fip.org. You may ask questions, and we encourage you to do so using the question box, the Q&A box, which is provided. You are welcome to provide feedback at webinars@fip.org. And if you are not already, we encourage you to become a member at fip.org membership registration, and you will have all the further information. May I add also that during the session, in the chat box, we will add some useful links, and you are welcome to save them. Setting goals for the decade ahead. That is a real program. And to go through this program, FIP has developed a comprehensive online event series that provides coverage of the 21 goals over 21 events, and all this in year 2021. The outcome of these 21 digital events is to mobilize global pharmacy development and transformation through these goals by engaging our profession, you, members and colleagues from everywhere, by aiming to provide a description, direction, and context for each of these specific goals. And of course, monitoring evaluation is very important through data evidence. And we will try to, with the last speaker, to identify priorities across practice, science, and workforce in doing so. So this is the time frame of this series of goals, of events. You can see here, it goes up to the end of the year. And we are here, we are the fourth event. Usually we have 2 events a month, except in September, because in September there is the World Pharmacist Day, and we have a special week, so we will have 4 in September. You are very welcome to go to events.fip.org to know more and to register. We encourage you to register to all these events. So the present outcome of the present event is to describe the FIP development goals and explain the component on the development goal number 20. In these 3 elements, the workforce and education, science and practice, to showcase the FIP tools, evidence and resources to support this goal across those 3 elements, to identify priorities across this practice, science and workforce and education within the goal, and of course to engage our members in an activity to support monitoring and evaluation of the goal through data evidence. So it's my privilege to introduce our distinguished speakers. I want to share with you, we have 3 speakers from the panel, and we will have a last speaker on the monitoring evaluating aspect. Our first speaker will be Aukje Mendel-Toivis. So Aukje is director of Utrecht University School of Pharmacy. She is the chair of a very important report which was recently issued, the FIP Digital Health in Pharmacy Education report. And she's a member of the FIP Technology Forum. She's coming from the Netherlands. And she will address on education and workforce. Then we will have another speaker, second speaker. Our second speaker is Paul Faré. He's an independent healthcare consultant. He is a member of FIP Technology Forum and also a member of FIP Data and Intelligence Commission. And he's coming from Ireland, and he will address on practice aspect. And our last panelist is Charlotte Werner-Rossing. Charlotte is the Director of Research and Development in Pharmacon, and she's a member of our FIP Technology Forum and of FIP WISE, and she's coming from Denmark, and she will address about research innovation. So this slide is to remind how the aspect of practice science and workforce education are embedded together. We cannot have a practice, for instance, pharmaceutical care, without a pharmaceutical workforce. And we cannot have pharmaceutical care without a scientific foundation aspect. And this is for all the next decade. This is part of one FIP goals. This here is all the goals. As a reminder, if you have not already seen this slide, we have 21 goals. And when you look at these goals, which have been developed by FIP, every goal is a part of our daily practice. And when you look at goal number 20, you could see that every goal can include a little bit of our goal number 20, because every goal can benefit from a digital aspect, something that is innovative, something that is adding safety, something that makes things more convenient, easier, and quicker to reach the goal. So finally, the goal 20 could identify, could inspire all the goals. And so I will not go through all the goals because we have a little video over there that I will go through now. This slide is to show how FIP is much concerned for a global dissemination of the goals. And you can see here the goals have been translated in several languages. You can access these translations through our website. Now we are going a bit further in this event, and we are going to listen to our panelists. We will first listen to the workforce and education element, then to the practice element, and then to the science element. And we will first begin with this Aoqiu, this workforce and education element. So Aoqiu, the floor is yours.
Thank you very much, Jacqueline, for giving me this opportunity to speak here today. So I will speak on workforce and education, and I think digital health is typically an area where we very much realize that it is not only the students, the current students that we need to educate, but also the existing workforce, because many of us, including me, who went to pharmacy school quite a number of years ago, have not really been in touch with digital health elements, I guess. So it's not only initial training, but it is also continuous professional development that we need. So we have identified a number of mechanisms how we can ensure that digital health is part of, let's say, the education, and what can we do? So the first one is to, I would say simply, but it's probably not simply, it's to develop courses, training materials, and experiential learning opportunities, as I mentioned already, both for initial education as well as early career training. And this very much links to the first FIP development goals 1 and 2. It's also important not only to have all of these materials available, but also to ensure that the necessary digital health and literacy competencies and skills are also included in the frameworks that we have, and which are used as the basis for developing curricula, for example. Again, not only in, let's say, initial frameworks, but also for specialists. And this links to FIP development goals 4 and 5. Another very important mechanism links to development goal 8, which is working with others. We really need multidisciplinary learning strategies that include interprofessional education. And what I think makes this an interesting topic as well is that when people talk about interprofessional education, people used to think about care professionals, doctors, nurses, for example. When it comes to digital health, we more and more realize that working together also means working with people who might be new to us to work with. Technical people, for example, ICT specialists. So it is beyond, let's say, the people that we usually work with when we talk about interprofessional education. We should also look for opportunities for continuous education and development, as I mentioned, to ensure that the current workforce remains up to date. And maybe even more importantly, whatever we teach today to our students might be outdated or changed in a few years' time. So even our current students, as soon as they leave the university, they need to embark on continuous education to stay up to date and standard in this very fast developing field. And finally, linked to FIP development goal 13 is incorporate digital health within workforce development policies. And this goal 13 is related to policy development, and it includes, for example, also employment policies, such as recognizing and maybe also creating employment opportunities in the digital health sector. Next slide, please, Jacqueline. And yeah, thank you. Oh, that was one too much. One back, please. Yes, thank you. So as Jacqueline already mentioned in her introduction, I had the privilege to chair this report together with my colleague Nilhan from FIP. And we had a great team of researchers, people from different backgrounds, organizations. And we embarked on this report and had the goal to describe the readiness, adaptability, and responsiveness of pharmacy education and knowledge and skill needs of pharmaceutical workforce on digital health. So we actually prepared 3 surveys to study this readiness and adaptability, but also the skills and the skill and knowledge needs. So we surveyed academics, we surveyed practitioners and students. And we had over 1,000 respondents. So we were very proud of this achievement. And people really came from a lot of backgrounds. It outlines, I want to mention a few of the results briefly to you. So what it showed is that more than 50%, so more than half of the pharmacy schools do not yet offer anything on digital health. And if schools offer something, it's often very limited to just a few hours per year integrated in other courses. For example, about e-prescribing or e-dispensing. I think these were the most topics, as well as apps. We hardly saw, let's say, full courses or mandatory elements that went beyond a few hours per year. Good to mention, though, that it was not only technologies that were being taught, but also common concepts like ethics, compliance, innovations, and also competencies, because I think many of us recognize that, of course, health technologies should not replace the pharmacist, but could be an aid to deliver pharmaceutical care. So we need the competencies to know how to integrate these technologies in everyday work. Most of the pharmacy schools indicated that they need more support. Part of it, of course, is time and resources. I think it's also more workforce themselves. So many schools indicated that they needed to rely on external experts, but also, again, materials, examples, good practices that people are looking for. When we asked practitioners, 1 in 4 only said that they were educated to some extent on digital health, either in their pharmacy school or thereafter during continuous pharmaceutical education, professional education. And again, mainly on e-prescribing, e-dispensing, and apps, whereas topics like artificial intelligence, wearables, digital therapeutics, these were the topics that people knew very little about. And for students, it was even less. Only 1 in 10 indicated that there was some form of a digital health education. We also asked respondents from academia to give us examples of initiatives, best practices, and these range from small elements in courses to full courses. And I would like to encourage you, if you're interested, to read the report and read the I think about 15 to 20 initiatives from pharmacy schools from around the world, from different parts of this world, how they incorporated digital health in their education. And hopefully this report will give the evidence base to moving forward to integrate digital health into pharmacy education and equip our workforce with the necessary knowledge and skills. And here is the link and also the QR code where you can find the report. Next slide, please. So while we're waiting for the next slide, I can already start saying that we identified, of course, a number of ways forward, and we try to translate these, let's say, more overarching number of ways forward into tangible outcomes. So we currently started a project that I will also be involved in, and also people from the FIP Technology Forum, but also from BPS and the Science Board on for a FIP masterclass on digital health for academics. So this is really a train-the-trainer masterclass, because many schools indicated that they need to have more teachers, more trainers available to deliver the education that we want. FIP is also working on a global curriculum and training resources toolkit for digital health education. Another way forward that we identified is that we recognized during the analyses that there were quite a lot of variation between regions in terms of what they do, in terms of what they need, in terms of what they want to focus on. So we plan to do regional analyses and also have regional roadmaps based on the current data that we have. And I'm not sure, but we may even reach out to some schools if we want to, when we are preparing these regional analyses and roadmaps. And finally, we embarked on a close collaboration with the FIP Technology Forum. I think my colleague Paul will tell you a bit more about the FIP policy statement on e-health and digital health. And we also plan to have a digital health resources webpage, because I think this is one of the things that people really indicated. We need the resources, we need materials, we need examples. And this is what we would like to provide also in collaboration with the FIP Technology Forum. I think I'll leave it here, Jacqueline. Over to you again.
Thank you so much, Hauke, for this very insightful presentation on the workforce and education element. We move now to the next presenter on practice element, and I am happy to introduce Paul.
Good afternoon, Jacqueline, and hello everybody from Dublin, Ireland. I'm delighted to be here to present to you on the practice element of the Digital Health Development Goal for FIP. So to start, perhaps we might talk about the existing mechanisms that FIP is using to actually advance this agenda. And I suppose the first area is that we feel that there are digital enablers and technologies out there that we can use, or we should be using, or that we will be using going forward, and to recognize their importance and how they can help and deliver innovative services and improve the care for the patient. An example of this might be, say, the shared records that you might have heard of that exist in England and Scotland, indeed the dossier pharmaceutique in France. Australia, Germany have made very significant advances in this area, as well as the Netherlands. So these really are very powerful tools to help pharmacies to actually provide care at the transitions in care where patients are most at risk, e.g. from transfer from the hospital to the community, transferring from the hospital to a nursing home, transferring from various units within a hospital. And this is where we see information gaps, and where there's gaps, there is danger for the patient. So it's important to recognize that there is tools out there that help us to do our job and to keep the patient safe. And we need to know what they are and to embrace them. We also need to demonstrate literacy in relation to digital health, to understand not only the importance and the opportunities it presents, but also how we need to safeguard the patient in that area, because shared data means data that can be misused or could be misplaced. Digital data is safer data because you can't lose digital data as easily as you can lose paper data. However, it's important to know that that data has to be used only for the actual purpose it is collected. So there's a lot of legal frameworks that we need to understand. There's also quality frameworks that we need to understand. There's no point in sharing information if it isn't accurate or complete. And there's also an awful lot of regulation around how we deal with people's personal health data, and it is their personal data. They own the data. So we do have to be cognizant of that. Another important point, and it's a huge opportunity really, is that digital health is a great enabler of healthcare. It allows for us to provide more efficient service. For example, in the last year, every country wants to vaccinate its population. The best way to do that is to get people to register and give their information digitally to the health services that are going to be providing it. And the health service in turn is going to be able to communicate digitally with the people, to give them an appointment slot, to give them the information so that they can provide informed consent prior to being vaccinated. So it does allow us to actually have a broader reach in healthcare. Everybody has a mobile phone in most countries nowadays, whether it's 3G or 4G. But I mean, this provides huge opportunity for keeping in touch with patients, for the health service to be in touch with patients, and for patients to be in touch with the health service. And then finally, we need to identify and understand the operational implications of digital technologies. We are going to be accountable for the information that we hold on patients, that we store on behalf of patients, that we generate on behalf of patients. So we have to be equally accountable with the colleagues that we share that information with. So we have to have proper channels of communication open to each other, like sharing information between community pharmacies and GPs, between hospital pharmacies and community pharmacies, even eligibility information in relation to patients. So we do have a level of responsibility that is there, and we do have to recognize that and embrace that as pharmacists. So, which brings me on to the next area, and they're the existing mechanisms. So what have we done so far in relation to the pharmacy practice element of digital health? Well, in 2019, FIP published a report in relation to mHealth, and basically this was the findings of a survey of 22 member countries around the world, and it showed, it just looked at what apps are being there, what's been used, what's endorsed by organizations, what are the good examples of them. And I think Farah has been posting an awful lot of information in the chat box about where you can get certain reports. So hopefully she will put a link up for this, so that you'll be able to look at that. And the results that are very interesting. Like, there's many applications out there that have been endorsed by professional bodies around the world. I suppose the examples that we could use would be, say, blood glucose monitoring is one of them. These new applications where you wear the patch and your app and your iPhone communicates with your hospital so that they know how your blood glucose is and your diabetes has been managed. It's been used for stock and inventories, for management of them remotely, for drug information online, on the move, and also to help in clinical decision support, dosage calculations, etc. So when pharmacies are on the move, so you're going to be able to have the information when you're with the patient, rather than having to go back to a book or go back to an office or go back to a pharmacy department to get that information. So it's a huge enabler. But I would encourage you all to actually to read that report. It's very, very interesting. So then, thank you, Jacqueline. And then the next issue is that last year you would have seen a statement, a position statement from FIP on emerging technologies in pharmacy. And this is in response to the actual reality that's out there. Digital disruption is moving ahead of practice in an awful lot of areas. So it's very, very hard to keep up. And it's going beyond an area that isn't regulated. So it was felt by FIP that it would be important to put out a position statement in relation to the emerging technologies that we're seeing, especially, say, internet services, etc. And I think what we are saying here is, no matter what technology is being used, it is important that it doesn't replace the pharmacy service, but augments it. So it has to be the same or even better, but it cannot replace the relationship that the pharmacist has with the patient, because that one-to-one relationship is very important, because a patient needs to be able to source good quality information and to trust the source. So while digital health is a huge enabler of it, of pharmacy practice, it doesn't replace it in any way. And while we should embrace digital health, we should never forget that it's very important that we are providers of healthcare, which is care in brackets and in inverted commas. So the care element always must never be neglected. So that leads on to the next area, and the practice and priorities, which FIP is focusing on, and especially the technology forum in FIP. If we could have the next slide there, Jacqueline, please. So, and this is something that Oike would have referenced earlier. We are currently developing in the technology forum of FIP a statement of policy on digital health. And this is very important going forward. It will provide a framework for how the pharmacy profession can embrace digital technologies and digital innovations going forward, how that will improve care for the patients, improve access to care, and improve the quality of care. And this is hugely important. It's going to lay down the principles that will be, and the framework that we will follow in advancing technologies and embracing technologies going forward. But it's always patient care that's going to be at the center of what we do. So the range of clinical services that are going to be provided in the future will be more sophisticated, but that is only going to be allowed by the fact that we're going to have so much information that we're going to be able to use and to actually do data mining on it. You could look at, for example, the advancements in cancer therapy, which is brought about by disease registries and cancer registries. In Ireland here, we have a high prevalence of the disease cystic fibrosis. And we have a disease registry for cystic fibrosis for the last 12 to 15 years. And that has allowed us to actually budget for the next 5 years what we're going to do and give us an evidence base for any decisions we make on reimbursement of the newer drugs that come out. And as actually Ireland has been able to actually bring those drugs to the market quicker and give access to patients quicker because of the evidence that we have. We knew that the drugs coming out were going to assist our patients because we knew the mutations, etc. So digital health has huge implications going forward, but it's very important that we have the framework to actually help us to make the decisions. Is this going to be in the best interest of the patients? So that statement of policy on digital health is with the member organisations at the moment, and hopefully the council will adopt the final version of that statement. So that is planned for September 2021. So moving on then, what can you do, or what can I do as a member of the pharmacy profession? I think, number one, we have to recognise in relation to digital health, we've had huge disruption in the last year because of the COVID pandemic. The way we work has changed. The way we communicate with each other has changed. I mean, everything has moved away from paper and from people moving things about to the information being moved about, because viruses move with people, but not with digital. So it's a much safer environment if you have a digitally enabled service. So you would have electronic prescriptions, electronic discharge documents, vaccination records are all going online, referrals are all going online. So we need to embrace this, but I mean, it is important to realize, we have to ask the question at the end of this, has this improved the efficiency and the safety of healthcare? If it has, that is great. We should strive to keep it. If it hasn't, we should seek to improve it or stop. If it's not safe, we should stop doing it. What is safe in the middle of a pandemic and what is safe in normal times are two different bars to actually measure something by. But it's very important that you, as a healthcare professional, look at your practice and say, what has improved in the last year? What do I want to keep? How should I lobby my local health service or my national health service to say, yes, what you've done there has improved the patient safety. Let's not go back to the old ways. Let's keep the improvements that we have. It's also important to actually let your member organisation inform FIP what is happening, because that'll feed into the actual, to something that I'm going to be talking about in a few minutes, which is which Oikyo referred to, which is the actual resource centre that we're hoping to set up. Also, you need to be aware of the disruption that's happening around you and coming down the road. With that in mind, I would point you to sort of a recent webinar that was held on online pharmacy, which was organised by the community pharmacy section. And I have a link there for you. And then also what you can learn yourself is to actually be aware of the resources that are available to you, both with FIP and from your own member organisations. And there's an awful lot of free links and free web pages available to you to educate yourself. So with that in mind, Oikyo mentioned that the FIP Technology Forum is going to develop a digital tools resource centre. And we hope to get that up and running towards the end of this summer. I will just say, watch this space. It's going to be very exciting. I think going back to what Oikyo mentioned earlier, we could encourage increased literacy in our undergraduate education in our local countries. and then also for ourselves to actually try and learn more about digital health and what is happening around us. If you can go to the final slide, please, Jacqueline. And so that finishes my part of it. But I mean, what I would encourage you is to actually participate with your local member organizations and to share as much information as possible with your member organizations and with each other going forward. Thank you.
Thank you so much, Paul. So many projects and so interesting, so exciting times. So now we are moving to the last aspect, which is the last element, science element, and we are listening to Charlotte. Charlotte, the floor is yours.
Thank you very much, and thank you for giving me this opportunity today to talk to you about how science will support the implementation of digital health. It's very nice to listen to both of you beforehand, because I think what we will look at in science is both the documentation of practice, evaluating what to keep on after the pandemic, and for instance after the pandemic, but also how to let new technologies come to market, how to let the technologies be evaluated in different ways. If we look at the development goal first, it is divided on the overall goal in the science area into the application of digital technology in healthcare delivery and the development of innovative medical products. And I will get back to both of these topics, addressing the research that is performed in these times. The mechanisms within this area are not quite as developed as in the education and the practice one that is to come. But I think it's very important to look at the mechanisms and see how they very well support the two former speakers. So we have to look at the education and the training of the pharmacists and the pharmaceutical scientists. So we actually have to be prepared to perform proper training and also proper research in this area. And then of course, enable integration of data science solutions to improve patient care. Next slide, please. Thank you very much. So first I will address the first topic that was in the overall goal, the healthcare delivery. This is headlines taken from the very good report that was given to you beforehand, and these are the overall headings that they use when they divide the different services or the different technologies. So first, I would like to talk a bit about what research is performed in the delivery of medicines. We see a lot of research done in the decision support in community pharmacies. What we see out there in many countries, or in all countries, we see that the amount of information is huge. It's for many years, it's actually been impossible for us to have an overview of the present knowledge at all times. So what decision support in community practice, but also in hospital practice and other places can help us with, is to have the relevant information available for the practitioner to use. What we see typically in these different research areas, in the delivery of medicines, the support of patients, but also in the different therapeutics and digital medicines, is that we see a close collaboration between a technical expert and pharmacy practice researchers. So you see the merge between how to fit it into pharmaceutical care and how to also develop the very best technologies. Then another area that is pointed out in the report is blockchains. Blockchains is the huge amount of data that we see around us being documented in big databases. And basically the blockchain technique or the technology is that we see a lot of different partners getting access to the same data. We have been talking about seamless care for many, many years. And this is actually using blockchain technologies is actually a method of getting different people interprofessionally collaborating around the patient care and delivery of medicines. We see a huge amount of research being done in this area to support this, because it's very important that the data going in is valid, but then it's also important to look at how can we collaborate around this. When I'm in a teasing mood, I sometimes say that technology is only like a calculator, so it doesn't work without people. And I think this blockchain technology helps us giving the data available at the right time. But if I don't want to collaborate with the doctor or the nurse or whomever, it doesn't work. So this is a very good example of that. The next two, big data and artificial intelligence, often in research come together. So basically, big data is, of course, the big amount of data we do in documentation and registration every year when we do our practice. And artificial intelligence is, of course, the different algorithms that are built to support practice. Usually we see these things working together. What you can do is that you can, of course, do research on how to support the right decisions for your business, for your community pharmacy, for your patients. You also see big data, for instance, on prescription being held up against guidelines around the world, and this can actually be a support tool to get a better adaptation of the guidelines in daily practice. And that is the next one I've said. So how to address the compliance to guidelines in everyday practice. Then the next one I've put up is supporting the patients. Paul talked a little bit about that in these COVID times, we have been forced into, for many of us, an online encounter with the patients. What we have seen over the years is that we've seen a huge research area in different technologies to support compliance. So different ways of monitoring. This can be in hardware, in pill boxes that register every time you open them, but also over the past years, it can be in apps, it can be in mobile devices and different technologies addressing compliance and compliance behavior. What we have seen from practice or from research is, of course, that some of these technologies work for some people, but not for all. Also, over the past years, we have seen a lot of people wearing wearables, so monitoring their daily life and their daily clinical data. These data makes it possible for the pharmacist or pharmacy technician to get access to data that they didn't have beforehand. So instead of waiting for access through GPs and others, you get access directly for the patient. That put demands on you as a pharmacist or pharmacy technician to actually interact with the patients. And we see research projects where you make interventions, where you try to support these different initiatives, support the wearables, and talk with the patients about the data they come and present to you. This is, of course, not for everyone. This is in some countries in particular, but we see these products getting cheaper and cheaper and more widely used. And therefore, I think in the longer run, this could definitely be a way to have a monitoring of a broader population also. And then, of course, lastly, there is online communication. This is also one of the things that we have been forced into. And as a healthcare professional, it is very important to figure out how can I do pharmaceutical care in a healthcare setting in a good way, so that the patient feels that they are met in a way where I can help them with their quality of life and their clinical outcomes. This is a huge challenge, but it's also a way of pharmacy to be available in every corner of the world. Almost everyone or a lot of people carry around a smartphone, and if you have a smartphone, you can almost always reach some kind of healthcare professional. Next slide, please. Then, if we move to the more the medical part or the new technologies that goes into this area, the first one I've put up there is digital medicines. Digital medicines, as described in the report, is of course where you have sensors in the meds, you have wearables that detect whether you take the medicine or not, you have app and you have dashboards. So you have healthcare professionals that can actually live track whether you take your medication or not. I will get back to how you assess the quality because that's very, very important. But this is a huge area and it's an area that is new. It's very new. And of course, all of these sensors and direct interaction with the patient based on their actual on-site drug use is a part of the personalized medicine and the personalized medicine use. Then you have an area called digital therapeutics. And some of the things that happens, some of the research coming out in this area is really amazing. It's a totally new way of thinking how you can actually help people get better besides with medicine. So there's of course apps, wearables, sensors, like I told you beforehand, where you based on clinical data can assess your medicines. But there's also virtual reality and games. The last one I heard about was very inspiring. It's a game for some young people with different disabilities, finding it hard to concentrate. They design games, online games, and test it in RCTs, like you would test a new medicines, and they see similar results, positive result on the different disorders. And this is a totally new way of treating these different disorders. And if it's registered as a treatment, it can be prescribed, and we would have as healthcare professionals to support these new treatments. It's very, very interesting. Then the last part I just want to touch upon, because Paul already talked about the COVID-19 pandemic and the treatments, different treatments with vaccines. I think one of the things as a scientist, I find very, very overwhelming and inspiring is the way that the speed on which these new treatments and vaccine has been developed, but also the speed in the sharing of knowledge. This would never have happened if it wasn't in a global world. And I think it's very important as a researcher that we can gather data as quickly as we can in this particular case. We should learn from this what will actually help us in the focus that we just had now. And then the last one, I just want to say that you cannot talk about research and you cannot talk about new technologies and adapting new technologies if you don't talk about quality. I've been looking around who have made qualities for different technologies, and NICE, NHS in England, and NICE has actually made a framework for NICE Evidence Standards Framework, where they go in and divide the different technologies into how much impact they have and how much interaction they have to patients. And then for each individual group of technologies, they have produced a full evidence standard framework so that you know how to test it properly, so that afterwards we can still say that we work with evidence-based practice. That's all for me, Jacqueline. Thank you.
Thank you very much, Charlotte, for this very inspiring presentation. This is a very exciting times we are living. Absolutely, definitely. So now we are entering the panel discussion with the questions. I will turn to Farah to choose and select the questions that we can ask to our panelists. But I must just say that something before we begin. You know, we are very delighted to be with you here. But you know, we are all working and our schedule is very tight sometimes. And this is the case today for Paul, who will have to leave us earlier because of an important appointment. So I would propose, Farah, that you select questions for Paul, so on practice then, so that he can answer before leaving. Would you have some questions?
Thank you so much, Jacqueline. Actually, we don't have questions from our attendees today. We have one comment from Lars, who says that he sees a future in which pharmacists use digital technology regardless of their practice setting and have access to enough relevant information to safeguard consumers and patients from the preventable harm medicines cause and maximize safe and effective use of medicines. He also sees a profound improvement in patient care that will achieve this, and the predominant enabler of these changes will be technology. Indeed, Lars. So, Jacqueline, I don't see any questions from our attendees in the Q&A. But here's a question. Here's one question that we just received from Donasha Fitzgerald. She says that there are several computational methods for treatment decision support that are being developed to take advantage of recent advancements in genomics and bioinformatics and transform treatment. With pharmacists' role and expertise in treatment optimization, we could take a lead role in their implementation. So how do you envisage driving forward pharmacists in this role? Jacqueline, would you like to direct this question to Paul?
Yeah, Jacqueline, that is a really, really interesting question. And it's hugely relevant, especially for hospital pharmacists at the moment. I think the whole area of cancer treatments is all based on bioinformatics, and the decision to treat with certain drugs will be based on screening, genotype screening of the patient and of the tumor cells and the stages that they're at. And I think we're going to get more and more personalized medicine as a result. So not every drug is suitable for everybody, even within for cholesterol treatments. You know, it's been shown that certain genotypes don't respond well to certain statins. So I think going forward, pharmacy is going to play a huge role in relation to screening patients. So you might have a situation in the future where doctors will prescribe and diagnose a condition and say, I want, and give you a target cholesterol, and the pharmacist would, based on the genome of the patient or the genotype of the patient, would prescribe accordingly and reach that target in consultation with the patient. I see that going forward, but especially in the area of cancer treatment at the moment is becoming more and more relevant. We have it already, as well as I mentioned in my presentation, in relation to certain cystic fibrosis treatments, that certain mutations will respond to certain drugs, and that is the case already. But pharmacy has a huge role to play, especially in hospital pharmacy at the moment, but I do see a future in community pharmacy as well.
Any other feedback for our other panelists on this topic?
Yeah, maybe from my side, Jacqueline, I think for pharmacists to be able to take that role, of course, they also need the let's say, appropriate education to be able to take up that role. And I think what some people fear with things like decision support and artificial intelligence is if you have basically ICT persons without any knowledge of disease, of treatment, that if you feed a large database with a lot of data, some data may come out that do not make any sense. And I think from my point of view, in many cases, I guess the pharmacists could be the ideal profession to take this up, because on the one hand we do understand, with our science background, we do understand big data, real world evidence and type like that, and on the other hand we can make that translation to clinical decision making. So I think we could be the bridge between, let's say, the clinicians and the clinic on the one hand and the ICT people, big data on the other hand. So and I think that in what I see worldwide in terms of development is that indeed some pharmacy schools start also courses in this area, and I think that's an important development as well, because just you always need your pharmaceutical background to understand what this basically the technology is delivering, I think.
I completely support this, Arthur, and you, Paul. It's absolutely the good vision. And I should say that pharmacists must take the slot. Otherwise, if they don't, others will do. So this is a real challenge, and we should enforce our competencies in this in this area, really. Charlotte, do you want to add something?
Yeah, just to add on from Paul and Eike, it's very true, and it's from a science perspective, we should put ourselves forward. We should sit down at the table together with the IT developers, even though it's hard and we don't know the language. We know the group that need the technologies. We are either the group ourselves that will need it in decision support, or we know the patients very well, and we should put this forward. It's crucial also, not only for the pharmacist, but it definitely for the patient, because we know the patients. That's the whole goal of pharmaceutical care.
Great. Should I turn again to Farah? Do you have new questions for Paul?
Yeah, I see a question there, Jacqueline, in relation to from Glennis.
Yeah.
Our remote reaches farther away, and our regulators looking at licensing requirements across boundaries. That's a really interesting question. I think it's not the technology that's really, while you do have the digital therapeutics that Charlotte mentioned, it's in certain jurisdictions you will be reimbursed in the pay, the pay market in the US, or in more sophisticated, say, payment models rather than the unified payment model. You will have varying levels of payment for digital therapeutics, etc. But I think what's going to happen going forward is we're going to be looking more at, I would think, disease treatment, and the person providing the care is going to be licensed to provide certain tools, and these are just tools at the end of the day. So you're not going to license the tools, you're going to license the people who will use the tools based on their licensing and based on the science behind them, as Charlotte referred to. So say the NHSX is looking at this area, and I think there's going to be further developments as we go on, but at the moment it's going to be the practitioner that is actually licensed rather than the product itself, because digital tools are based on algorithms, and I think you can't legislate for one person and not another, because all patients are different, and what might suit one patient mightn't suit another. So it has to be the healthcare professional making the decision. I don't know if Charlotte and Eike would agree with that. Yeah.
I think it's the same you see with vaccines right now, actually. It's that you get an accreditation or whatever, you get a certificate that you can vaccinate. It's exactly the same. It's one of the calculators up there.
There was a question in the chat I've seen about technicians. How useful are pharmaceutical technicians in your technical operations? That's a question from Jonathan Mela. Do you
Can I start with that one?
Yes.
I think it depends a lot. We have done quite a bit of research on pharmacy technicians and the role of pharmacy technicians here in Denmark. It depends a lot on your setting. It depends a lot on the education of the pharmacy technicians. In Denmark and in many countries, much of the personnel that the patient meet when they first come into the pharmacy are pharmacy technicians. So they definitely have a role. If I should go to Paul and say, so what level will they deliver on? I think that depends from country to country. There's no one question to that.
I think it'll depend on competency frameworks being properly developed, because we're all just regulated to train within our own level of competency. So I think competency frameworks are very important going forward, both in the relation to the service we provide, how we provide it, who we provide it to, and what we are capable of providing. And I note in the Q&A there, I think Dunica was talking about consider computational specialization for pharmacists. That would be a very specialized area of pharmacy. So there'll be a particular competence for pharmacies involved in that area. And what I might say, that seems a great idea. I would like Dunica to get involved with FIP if he was willing to help us in that area, because it's an area that we do need to develop the expertise of the pharmacists in the bioinformatics sphere. But it has to be based on competencies. Yeah, for everybody.
Yeah, and if I
Please. Okay.
Yeah, and if I can add, I guess, thinking about education. So pharmacists and also our pharmacy students should therefore be able also to guide and help and instruct pharmacy technicians to use these technologies. And I think you can only instruct somebody else if you yourself are first familiar with it, but also I mean, not just familiar, but really know, also have a vision on what you want with it. Why would you incorporate a certain technology in your pharmacy if you are not able to discuss that and that with your pharmacy technicians? I think you have a difficult time. So that also requires a certain type of thinking, and maybe also something like innovativeness that might not be in the DNA of many of the pharmacists that we currently have. So that is also something that we as academics should probably work on as well.
Yes, I support this. There are many disparities among the world about technicians' position. I see a technician workforce is very, very important in France. And when it's like in Denmark, I suppose. And when I think of Japan, which is known to have no technicians, as far as I know, I just wonder how they do, how they manage, because it's like the right arm of the pharmacists in France. So it's so important. We couldn't do without the technicians. So obviously we must have the technicians with us with the same competencies, or at least almost the same. But we should always think about our technicians. Okay, Paul, I know you are in a hurry, but would you answer a question about your recommendations that pharmacists can assess their ability to engage with digital health in practice?
Yeah, I think I referred to competency frameworks there earlier, and I think going forward, digital health is not, it's just replacing paper with and communication methodologies. We're doing it already. It's just it's how we do it is going to change. So I think people get afraid of, oh my God, it's a computer, it's, I go online. It's just passing information around in a safe and effective manner and enabling information to be used at the appropriate time in the appropriate place by the appropriate people. So I think what we need to do is we need to realize what we're doing already. We're just going to replace it with a better means of doing it. So it was like 50 years ago, 60 years ago, we were using log tables and long mathematics, and now we're using calculators. So I mean, pharmaceutical calculations didn't change in that time. It's just how we did them changed. So that's what digital health is about. And I would really say to people here, don't be afraid of embracing your digital health journey, because it's going to enable you to do your job much better than you can do it now, more efficiently, more safely. It's going to be more encouraging for you. It's going to be more professionally fulfilling for you. It's going to give you an increased knowledge of your patients. It's going to give you increased knowledge of health and how health services are delivered. So I think going forward, we just need to think of it as, okay, I can do a pharmaceutical calculation. Well, yes, I can embrace digital health, and it's something that becomes second nature to you. So I think competency frameworks are going to be good for that, because you're going to be able to assess yourself rather than be assessed. So I feel happy taking information from a doctor in a digital format instead of having to have paper all the time. That's basically what it's down to. Or I will be able to send a secure message to a doctor about a patient. And I mean, it's not going to happen overnight, but I mean, it's all learning and practice, and you develop competencies that way, and we all need to help each other and develop the competency frameworks that are relevant to our countries.
Okay. Thank you, Paul. Thank you so much. So I propose we look at the questions for the education and workforce point of view now. Farah, can I turn with you?
Yes, Jacqueline. Actually, we have two questions in the Q&A box. One is from Elena Tershanova, who's asking, how do you see a role of reimbursement in digital connected health implementation? How could it be implemented in an out-of-pocket private markets?
I'm not sure I can answer that question from the education point of view. So I guess this is not about reimbursement of services, but really reimbursement of, well, it's probably about a reimbursement of the services that are delivered then, isn't it? Yeah, so I'm not sure. I'm not an expert on this. What it stresses, and I think there were kind of similar questions in the Q&A related to reimbursement, to regulation, to licensing, is that when we think about digital health education, it is beyond understanding how an app works or what digital therapeutics is. It is also having our students think about these types of things. If you want to implement a certain digital service, you need to think about compliance, about interoperability, about reimbursement, about maybe regulatory requirements. So I think it just stresses these types of questions that that we have a lot to embark on and to learn and to discuss. And I'm sorry I don't have a real answer to that question, but it reminds me again of how important all of these discussions are.
Thank you so much. And the second question, I'm not sure how directly related this is to education, but we have another question from Leif Siner, who's asking, do you think pharmaceutical companies have contributed to the development of digital health tools? And also, do digital health improvements slow down when regulations are more concrete in terms of safety issues in the future?
Well, again, especially the second part is a bit hard. What I know from the digital health course that we that we run is that yes, indeed, some of the pharmaceutical companies have, of course, also developed their own apps, for example, that come with a certain treatment. So I definitely think that it is not only, let's say, the big pharma companies, but especially also spin-offs and small startup companies that are really contributing to the development. And again, I think it sometimes goes faster than we realize. So so I think it's a definite yes. And then again, in terms of education, I think it's one of the things that we really need to educate the current and future workforce is in how to select the most appropriate digital health tools. Again, the same with medical information. So which type of information do you trust as a pharmacist? Which type of information do you share with your patient? Is that the information from the company? Is it the information like the patient information leaflet? Is it information from a therapeutic bulletin? And that is what, at least in our pharmacy school, we try to teach our students what is good information. And I think we try to do the same with the tools and the technologies. How can you recognize a good quality technology, an independent technology? And if you use a technology that is being developed by a pharmaceutical company, I wouldn't say that you should never do so, but you should clearly evaluate it yourself. What is the added value? What are potential pitfalls, potential challenges? And that is what I strongly believe we should also incorporate in our teaching, both at the academy as well as in continuous professional education.
Thank you so much, Jacqueline. We don't have any other question in the Q&A box, so I'll hand back to you for a question that is directly related to education.
Yes, I do support what all you have said. Evaluation is key. Otherwise, you cannot measure the progress. So the skills among the students are difficult to evaluate, I suppose, but it's so essential. So, okay, so time is running. I propose we look at the questions on the science and research aspect. Do you have some questions, Farah?
No, we don't, Jacqueline.
Okay, okay. So I will ask a question to Charlotte. I have noticed that sometimes some of our colleagues don't have much interest in in digital matters. So I would like to know if what would be the best way, from your perspective, to raise interest for digital research and digital improvements among pharmacists in their daily practice.
Thank you very much for that important question. And for me, it's almost impossible to believe that not everybody thinks this is the most important thing in the world. No, putting aside, I think there's different research with different aims and different demands on outcome. I've always been in pharmacy practice research. So for me, it's important to have the practitioners included, because I want to do research that actually changes practice afterwards. And to do that properly, I've learned over the years that it's very important that I find something that is relevant for the practitioners. So it's important that it's not my problem, but it's the practitioners' problems that we solve. And I think it's exactly the same here. What we have done in Denmark, and actually you have also done it in Holland, is that we have made a national network of pharmacies that want to work with the research and development of the future and development of new services in the future. And that gives us a pool of practitioners that asks for new research, asks for new practice, and say, I like to test this technology if someone comes to us. And we also made a forum where people come and say, can this be tested in a pharmacy? So we actually have a network that supports the implementation, but we also have a network that gives a high engagement among practitioners. So for me, that's a win-win situation.
Great. So I think I hope it will inspire our participants. Okay, is there some final remarks you would like to add, Aukje and Charlotte, to this panel discussion?
Jacqueline, there is one more question, if I may add, to Charlotte. From the Q&A, Oleg Benja Ajolo asking, how can schools of pharmacy in developed countries partner with selected schools of pharmacy in the developing countries to support digital health education?
I think the international network among researchers and among schools, actually, and I think Eike is probably better at answering this than I am. I think FIP is the perfect platform, because we see a link between the different institutions. We see a link where you can team up with different countries and different institutions that is at another level of engagement in this healthcare technologies. But maybe Eike, you can help me also.
Yeah, sorry, I had to unmute. Yeah, so I agree, and I think that both the academic pharmacy section as well as AIM do also have programs for, let's say, leadership support and things like that. So that could probably also be an opportunity. The academic pharmacy section also had what we called specific COVID grants for people from low and middle income countries. When we first started with the COVID grants, this was really related to the COVID situation, but more and more we want to broaden up the grants, because it is not only about COVID itself, but it is also about, let's say, having virtual education, but also education about digital health pharmacy. So I think that would also give opportunities for small grants to team up. So I would encourage people to also look into that. And I think, and I will take this also on board in the train the trainer program, and also the regional approaches that we want to do, because I think what we've learned, and that's also a bit what I see from the chat and the Q&A, is that many of the things are very region specific. Like I noticed in the chat that somebody from a country said, well, we don't have that many computers. So that in itself is difficult, but it goes beyond computers, because I know, for example, in Africa, that many patients do have mobile phones. Yes. So even if you don't have a computer, but you do have a mobile phone, that is also digital healthcare. And I know a very important or a very typical example from China is where you have a booth where a patient in a rural area can go into that booth. There's a chatbot that can help with having a diagnosis, and the medicine comes out of the dispenser. So there's no physical interaction with either a pharmacist or a GP even. And you can say, well, this is maybe in some cases where people do have access to care, that would be the wrong way. But if people don't have access to care otherwise, this would be a first great step forward. So I think it very much depends on your situation, how you also see these type of activities and developments. And so I think teaming up is important, but we should then also ensure that the real needs of, let's say, the developing country is really met, and maybe teaming up within a region make then more sense as compared to looking to countries that have opportunities that another country might not have. So, but we will take this on board in the trainer program.
Great, thank you so much. Thank you to our distinguished panelists. Thank you, Auke. Thank you, Charlotte. Thank you also, Paul, who has left, as you know, for your inspiring presentation and all your comments. That was very, very helpful. So we are grateful. Thank you. So I will move now to our next presenter, and I will share my screen first.
I'm going to share my screen, Jacqueline.
You're going to share your screen. So,
yeah.
Okay. So it's a pleasure for me to present Mr. Christopher John. So Christopher John, you have a slide, I think. So Christopher is the FIP lead for data and intelligence. You know, I have mentioned the Data and Intelligence Commission a bit earlier. And he is working within the GPO, which is the Global Pharmaceutical Observatory of FIP. And he will present about the importance of evaluation and assessment within data evidence. So Chris, the floor is yours.
Thanks, Jacqueline. Hello, everyone. As Jacqueline says, I'm talking about monitoring and evaluating Development Goal 20. I'll just be spending a few minutes on that. I'll talk a bit about the Global Pharmaceutical Observatory alongside that. And we have an interesting interactive activity for you to undertake, which is about telling us what you think the important indicators will be for monitoring progress against this development goal. And the Global Pharmaceutical Observatory is key to monitoring progress with all the development goals, but particularly today we are looking at Development Goal 20, Digital Health. The FIP Global Pharmaceutical Observatory's mission centers around data, intelligence, advocacy, and reporting. We have heard from all of our speakers the importance of data, and for data to provide us with evidence, and for evidence to provide us with intelligence. So our first task is always to collate valid global data on workforce and education, practice, and pharmaceutical science. We must undertake comprehensive analyses of collated data to provide accessible, high-quality intelligence, and all this must be communicated innovatively to promote our member organizations, our FIP member organizations' impact on health. This communication will often be via the FIP Atlas, which is our visualization platform for displaying our data and intelligence across the globe. And finally, we will provide evidence-based strategic information reports and guidance on the application of pharmaceutical science policies, practices, and services. The FIP Global Pharmaceutical Observatory's outputs and influences are about sharing and disseminating intelligence that informs policy formation and advocates for the profession. So this could be applied specifically for digital health. It's also about country monitoring, reporting, and information comparisons, research and analysis, evaluation of trends to support action planning, and different countries are at different stages with the development goals, facilitating collaborative working and national and transnational networking, evidence generation for capacity building, and the potential for linkages with other observatories, such as those of the WHO and OECD. And most importantly for today, health systems strengthening by tracking progress against the development goals. Just briefly letting you know about current GPO actions and projects. We have a big project running called the METNA project, which is the Multinational Education and Training Needs Assessment project. And this is a first global pilot of mapping education and workforce needs assessment using the FIP development goals as a framing device. So we are aiming for data retrieval in partnership with member organizations and using the project to develop a comparative assessment in terms of priorities across regional commonalities. So this project is underway, and the main aim is to address multinational needs assessment education for the pharmaceutical workforce in a cohort of nations across the globe and evaluate policy gaps on a regular basis. As previously mentioned, we are also working on the Atlas, which is our online visualization platform to display important intelligence. So we'll be able to do this for Development Goal 20 on digital health. And linked to this is the development of a dedicated GPO website and database, which will serve as a repository for all the data we collate. We are advised on the strategic direction of our work by the One FIP Data and Intelligence Commission, which meets regularly, and we have members here today. This commission discusses the big ticket items that provide assurance and guidance on achieving the GPO vision and mission. Finally, and the reason why we are here today, we have an important project that aims to produce indicators that will measure and monitor progress towards the development goals, which is where you all come in. So we have a short engagement activity for you, and you can use the QR code on the screen or indeed copy and paste the link on the screen now. Here at FIP, we are now seeking to develop indicators and country-level metrics to measure and monitor progress and the performance of implementation of the FIP development goals via the Global Pharmaceutical Observatory. So we'd now like to seek your support for this Global Indicators and Metrics project by contributing to this brief activity linked to the current digital event on Development Goal 20. We would like to know your opinions about how digital health and progress towards digital health can be measured and monitored. As I said, there's the link on the screen. You can copy and paste into your browser. There's also the QR code. It only takes a few minutes to complete, and your input is very important to us. It'll help us develop the indicators and metrics needed to measure and monitor progress with implementation of Development Goal 20. So that's all I had to say. I know there is another event coming up in the Development Goal series, Setting Goals for the Decade Ahead. And that's episode 5, which will focus on Development Goal 1, which is academic capacity, and that's on the 26th of May. The time is 11 to 12:30 Central European Summer Time. So I know I have to highlight that to you.
Yes, Chris, thank you so much. This will be episode number 5 of the goals, and I encourage you to register. You can go to events.fip.org and you can register for this event, but also for all the other events. And I really encourage you to register. Thank you for filling the survey that Christopher has presented. It is very important for us. What Christopher is doing is key for FIP, and it's a really a very important pillar in the FIP, the One FIP strategy. So we are coming now to the end of this webinar, And I would like to thank all of you, our presenters, our panelists, of course, which has been so interesting. Christopher, of course, which showed us so important, the importance of the evaluation and assessment and in the Global Pharmaceutical Observatory. And I would like to thank all of you who have been who have showed your engagement with your questions and your comments. It is very important for us to feel that you are here. So please register for the next events, and thank you for your support. Thank you, all of you, and bye-bye. Bye-bye.